This is the second part to our adult brain tumors lecture. My name is Bronte. I'm a medical student at Wake Forest School of Medicine, and this is a part of our Radiology Scholars Certificate Program. So the learning objectives for this presentation is to be able to identify common adult brain tumors and recognize specifically hemangioblastomas, schwannomas, and metastatic tumors on CT and MRI. Brain tumors are commonly divided into adult brain tumors and pediatric brain tumors. We're going to save pediatric brain tumors for a different video, and today we're going to be talking specifically about hemangioblastomas, schwannomas, and metastasis. Hemangioblastomas are malignant tumors that have cysts and nodules. They are associated with von Hippel-Lindau disease, which is an important association for medical students. If the tumor is more aggressive, there will be more edema, and if it's slower growing, it'll have less edema. It is normally located infratentorally, so in the posterior fossa in adults, as well as the spinal cord. On the right, you can see an axial image from a non-contrast CT. You can see the cystic appearance with a mural nodule. The cystic portion is usually hypoattenuating on CT, and the mural nodule is isoattenuating on CT, and that's demonstrated in this picture pretty well. Of note, there can be other tumors that have this cyst with nodule appearance that can look a lot like hemangioblastomas on imaging. Some of these are listed on this slide below. MRI is another great imaging modality to help with diagnosis of different brain tumors. On the left, we have an axial T2 FLAIR image, and on the right, we have an axial post-contrast T1 image, both of hemangioblastomas. If you look at the diagram on the right, you will see that the FLAIR has a cystic portion that is iso-intense and a mural nodule that is hyper-intense, whereas the post-contrast T1 image will have a cystic portion that is hypo-intense and a mural nodule that is avidly enhancing, and these images demonstrate those principles very well. The next tumor we're going to be talking about are schwannomas. Schwannomas have a high association with the condition NF2. If you see bilateral vestibular schwannomas, this is virtually diagnostic for NF2. The typical location of schwannomas are in the cerebropontine angle. They arise from the vestibular nerve and typically extend and expand into the internal auditory canal. We have an axial image from a non-contrast head CT here on the right, and as you can see, the schwannoma is iso-attenuating to the brain, so it can make it very difficult to see on CT, but it can also show mass effect on the fourth ventricle, which is demonstrated in this image. The differential for schwannomas will also include meningiomas, but meningiomas usually will not expand into the internal auditory canal, and they will also have other characteristics such as a dural tail. And here we have some MRI images of schwannomas. So on the left, we have an axial T2 FLAIR, and on the right, we have an axial post-contrast T1. On the T2 FLAIR, you can see the hyper-intense mass that extends and widens the internal auditory canal. The hyper-intense signal along the posterior medial margin is from edema. On the right, you can see the post-contrast T1. You see the avidly and homogeneously enhancing mass, which is indicative of that schwannoma. As you can see, it's a little bit easier to identify the mass on MRI than on CT in the case of schwannomas. Lastly, we will be discussing metastasis. The reason it's so important to talk about metastasis is because it's actually the most common brain tumor in adults. There can be numerous lesions or a single lesion, and they may solidly enhance or may demonstrate ring enhancement, although the ring enhancement is more common with larger metastatic lesions. They have a propensity for the gray-white junction and are therefore often peripherally located, but you can see them anywhere throughout the brain. On the right, we have an axial image from a non-contrast head CT, and you can see the peripheral vasogenic edema caused by the metastasis. Here we have some MRI images of metastatic lesions. On the left, we have a coronal T2 FLAIR, and on the right, we have an axial post-contrast T1 image. On the T2 FLAIR, you can see multifocal areas of peripheral hyperintense signaling. This is corresponding to the numerous metastatic lesions. As you can see, these lesions are throughout the cerebrum and the cerebellum. On the post-contrast T1, you can see the ring-enhancing lesions, which shows peripheral enhancement with that central hypo enhancement, creating that ring-like appearance. If the metastatic lesions do not cause much edema, it can be virtually impossible to diagnose without post-contrast imaging. That's why in brain tumor evaluation, it is very important that you receive an MRI with and without contrast. Here are some of the references that I used to create this presentation. Thank you so much for listening, and take care.